Thanks for joining us. I'm Patti Artley. I have the privilege of hosting, and I'm the chief nurse of Medical Solutions. We have a great topic for you today, boosting the first-year retention strategies. And you're going to hear about a lot of things that really work. And this is a great opportunity for you today to just take bits and pieces. This is many years in the making for Onvida, and I want to make sure that you're listening with that thought process of what are those one or two things that I might be able to deploy right away, and some of those that we might put in as strategies as well. Just a little bit of housekeeping for all of us. Just a reminder that we will have question and answer. If you wouldn't mind putting those in the Q&A section, because our chat function is disabled. And we have Lydia, who's going to be helping us by reading your question and making sure that we have that. All of your cameras and microphones are disabled for you, just because we want to make sure that there's no disruptions as we're going through the process. And you're welcome to submit those questions at any time, because we'll do them at the end, as I said. So thank you so much for joining us. We are so glad that you are here, and we are so honored to have Deb here. So just a little bit about Deb Aders. She's the Chief Nursing Officer and Senior Vice President of Patient Care Services at Onvida Health. And Deb really has been the catalyst behind dozens of process improvement initiatives for her organization, really improving patient care, preventing infection, cutting waste, and ensuring that the positive patient outcomes and positive patient experiences are recognized. Deb joined Onvida in 2011 as their Director of Quality, later promoted to Administrative Director over that department, and then was named as chief nurse since 2016. She's played essential roles in how Onvida Health has been recognized in multiple areas, both in quality, service, and excellence. And as a result of her leadership, the hospital earned many recognitions in quality and excellence, including accreditations in cancer care, bariatrics, radiology, and stroke care. Those are some accomplishments there, but not outdone to that she has led the hospital through Malcolm Baldrige National Quality Award and ANC Pathway to Excellence designation. And I've walked through both of those doors myself, and those are not easy accomplishments, Deb. So we are so grateful to have you here. Thank you for joining us.
Glad to be here. So whatever I can do to help, I just think, we have to try multiple things. You never know what's going to work. You just have to be willing to make those changes and make adjustments and find out what works for you, because it is unique. Every organization does have unique abilities or unique qualities about them.
Could not agree more. And one of the things that when you and I spoke early on, during our prep for the session, were about your statistics. Your statistics are pretty impressive. Would you mind sharing some of those statistics and how you went about gathering them?
So some of the statistics, you can look at different, this was just the most recent I gave, which is we track turnover rates, but not just organization turnover rates. I get very specific into new grad turnover rates, first year, second year, our nurse extern turnover rates. I watch for specifically if they transfer throughout the house or do they transfer outside, and as to why. So as you can see, our year-to-date turnover rate for nursing is 9.8%. But I like to think my attrition rate is 0.88. So I'm like, something's working. I'm not sure if everything is, but something is definitely working. But if you don't have the data and if you don't track that, you're never going to know what works and when it doesn't work. So we have monthly meetings, monthly statistics. We look at different kinds, but these are the ones I want to tell me, is the actions taken actually making a difference?
This is really impressive. And this is why I know that we had so many individuals interested in this topic, because when we think about that year one turnover in general has been challenging for nursing across the board. When you look at national averages that are still in the 18 and 17%, but the year one turnover that was at 33% a year ago and now averaging about 27%, when you look at yours, this is really, really impressive. So I'd say you're doing something well as well. So when we spoke, you really shared that you are focused on growing your own. Would you mind talking to us about what does that look like and why is that so important to you?
So if you don't, I'm from Yuma, Arizona. So we're not necessarily a destination location, right? We are in the middle, 150 miles from Phoenix and 150 miles from San Diego. And we're just the only facility out here. So we had to figure out, it was taking like 120 days for even a nurse to fill an application with any experience whatsoever. And that wasn't going to meet our needs. We just knew, especially after COVID, that wasn't going to work. So we looked at who we are, what is our community, what are our community students in high schools and colleges say, and basically made the decision that we're going to have to start, even if it's a brand new a new nurse program, that's what we're going to do. So we worked with all the schools. We developed different cohorts, size of cohorts. We became instructors, locations. And then we also engaged with the students while they're still in school because we created nurse extern programs. Nurse extern ones, you're only got 2 semesters under your belt, but we actually hire them to give them experience in the facility, but get them enculturated into an organization. And we have nurse extern 2s. And then we have the students almost 9 months before they actually become a new grad. So I think that has made a difference that we become a team together. And then my staff has really embraces the nurse externs. They feel like when you talk to the externs a lot, and I do a lot of rounding and talking to a lot of externs, it's all about they feel like they've become a family and they found their little niche and they've kind of found their home and they're not even graduated yet. So I think that's the piece is we welcome them. And if you look at some of these program information, I just gave you the last kind of since October this last fiscal year. These retention rates, I think, speak for themselves. And when they do leave, what we find it's because either their spouse has been transferred to another town, or they have chosen to do a different, like a rehab facility or something that differently than hospital setting. But it's like, otherwise they stay, and that's the whole point. Right? So how do I keep them here? How do I make them feel like they are important? And how do I make them feel like we listen and we want them to be involved, especially in shared governance and driving change?
Well, we've heard from graduates, whether we're reading it in the literature, we survey nurses, and the graduates say they want an opportunity to grow both personally and professionally. When they're looking for organizations, that's what they're looking for. So how do you give them that opportunity? What are those things that you've done that help them grow in your facility that keeps them there year 1, year 2, year 3, and keep producing for you?
One thing we figured out we had to do is we had to totally upend our clinical education department and how we even looked at our nurse residency programs. We redesigned their nurse residency with a different focus based upon what we were seeing nurses coming out with talents and where gaps were. We also, so we interviewed them. We started interviewing them when they come, where they feel good at and where they don't, and then kind of like where they want to be. We developed a transition to practice program, and we expanded mentorship, and we also changed our preceptor program. The old saying used to be, and I've been a nurse for quite a while, your best preceptors were always the ones who've been here working 5 years, they're a BSN. Those are the ones you want to be preceptors. Really, we kind of threw that out and basically said a new nurse after orientation is a preceptor, if nothing else, for a nursing student. So we have to start at the very beginning, ingraining in part of our education how to be a preceptor, how to be a teacher, how to be a learner, how to, is part of your skill set. This is part of your skill set. And we had to also give them opportunities to learn new skills because a lot of them want to continue to learn. We do have an employee into our HR department. They do have scholarship programs, but we do college tuition reimbursement. But we also wanted to give them different ways of shared governance through the One Clear Pathway, which we have, what we talked about, that actually builds on skills. So if you want to build on skills, we're going to give you that opportunity, but it's also going to be a recognition for you as well as you move up a career ladder, as you continue your portfolio, anything we can do to actually help them grow. I mean, and sometimes that growing might be moving from one department to the next, but we embrace that and we encourage that if it keeps you in our organization. But we also are giving them the opportunity that if they go to a different department and they don't necessarily feel like it's a fit, you have a home. You don't like your position's filled and you can't go back. You will always have a home, and we will always honor that.
That's one of the things that I'm seeing throughout organizations. Their trouble with, or the challenge they have, is really that sometimes leaders don't want them to move, right? We've invested so much in them. How did you get your managers around that concept of we want to invest in you and nurture you and care for you across the system?
I think that was a discussion about when you talk to the managers and directors, it was a more of like, who do what kind of nurse do you want in your unit? Do you want one who's unhappy and still here? Or do you want one that's actually, if they go and learn different skills, just has positive things to say about where they came from, where they're at now, about the organization, so we can further feed into people wanting to work here, and what's best for patients. An unhappy nurse is not best for patients, but helping a nurse grow and keeping a nurse in the profession is important. That, there's going to be a lot of people leaving the nursing profession over the next 4 or 5 years, and we have to try to retain those nurses in this profession, even if it means your unit, like our progressive care unit, is a feeder unit to the ICU. But we embrace that. We train that those two departments actually train and orient and do their training together. So they become partners. So what we've done is we start to partner different units. So they cover for each other, so it's an okay recognition then to move forward, because now we're elevating you, but you're also learning from that other unit is also learning as well.
I love it. Well, we hear over and over again that nurses, as they're coming out, they want to feel that they're cared for. They want to feel cared for both personally and professionally. And it sounds like you've done that. You've given them a voice. Can you talk a little bit about that and how they feel like they're being heard?
I think that happened a lot when we did the transition to practice program, and we did mentors, and we changed the preceptor program. If we invested in you, you could easily sign up for whatever classes you want, no matter what. But it's also about, we do engagements. We were doing engagement surveys almost quarterly just to try to feel out. And then we finally have moved to, and then it's every 6 months, and then to an annual, just to figure out what you need. Everything from what is a staffing challenge coming out of COVID. Staffing was really scary for new nurses, right? They were really fearful, because especially those who never worked on a unit. So how do we make you comfortable? How do we address your fear of well-being and not burnout? But also that your voice matters, and how you can make decisions across the organization. The engagement survey, when you look at it coming out of COVID in 21, it was pretty dismal, right? It was just pretty dismal. So we had to address, challenges are open. We have diverse perspectives. We listen to you. It's a great place to work. Your workload is reasonable. We went from 28.9, even though it's 69, that's a 40-point jump almost. You just don't have those jumps in those matter of years. But I think it's just important that we listen and we give feedback. We have to do different things. They have to have opportunities. And sometimes those opportunities are where I may round on units, but I also have what I call breakfast with Deb. Any nurse can sign up and we talk, and there's no agenda. It's their agenda, right? And sometimes that's where they bring up issues, simple things of, we talk about uninterrupted lunches. You deserve those. How do we achieve those? The last survey, I'm going to laugh at this one. I couldn't believe it. Like, what is your greatest wish? They wanted a frozen yogurt machine in the cafeteria. I mean, it's little things, but that tells me we have come a long way in listening and honoring their wishes.
It goes a long way when people feel like they've been heard, right? Even if it is a yogurt machine. I think this is a great time to also talk about your One Clear Pathway. When we talk about investing in people, This is exactly what that is. Why don't you share with everyone what that one clear pathway is?
So the one clear pathway is not, we have nursing ladder, career ladders, but the one clear pathway is something that the nurses can do on an annual basis. You get so many points based upon certifications, willing to take on a committee and be part of a committee, willing to take on tasks. You're willing to be the hand hygiene expert of your floor, willing to learn a new skill, and willing to be a preceptor, willing to be a mentor. Those are given so many points. There's different categories of education, training, shared governance, skills. So there's a wide variety of areas that you can do it. Points are given, and we actually give, it's not really, I don't want to call it a bonus, financial bonus, but to me, it's an actual kind of a recognition for them about the time and the hours they spent. And that's done on an annual basis. They can earn up to $3,000 a year in the middle of the year. So, they feel like that their work means something, because part of their well-being is also financial well-being. Some are coming out with debt, some are coming out with trying to figure out ways to fund different things. You find in our community, it's a lot of poverty levels people who went to school. So it's a lot of helping them with that, but it's also they feel like they have things that they can actually never thought that they could do before. But what we found is people, when they do this clear pathway, once they get into it, they never leave. They grow and they want to do more. So then we then our challenge now on our side is how do we offer more? And then the offering is, what is it you want to be the offerings that we should actually take credit for on that one clear pathway that demonstrates your commitment to the organization and to your own growth.
I love it. What you're allowing them to do is really say, I'm interested in this. And then they go down this pathway. It's like building their own career path, right? But it's also things that you've driven towards, things that are going to help your organization achieve the kind of quality and safety excellence that you've already demonstrated. When we talked, you mentioned that this is the year of technology, and that's your focus over this next year. Can you share a little bit about what you've learned from your team that is helping you frame that for this next year?
So, there's a lot out there. We found that, just listening to especially the younger generation, everything's in their hands, right? Everything technology is in their hands. So we knew we had to take a step back and really just look at the tools that we put in their hands and how cumbersome we made them. Or what tools did we not have in their hands for them to do their job as readily? We have Epic, so Rover, but actually putting a phone in their hand, but it's not. But it's saying this is not a phone. This is a computer that is readily available in your hand when you go into a room. That it's going to allow you to provide care, right? So redesigning our rooms. We're in the process of building a new hospital. All the rooms are designed as smart rooms. Redesigning technology around natural workflow, because a lot of EMRs don't follow natural nursing care. One of the things I try to instill into our IT is nurses are not end users, nurses are co-creators. So you need to embrace a nurse to design a system that works for a nurse. Our next thing that we're working on is ambient listening for nursing. Physicians have it a lot in ambulatory clinics, but we're watching trials of places where nurses now become conversations and don't document because the conversation is the documentation. So that's where we think is the next step to go to.
I love it. So before we go to question and answer, because I do want to give some time, I want to know what's next for your organization. What's next on your strategic plan?
So strategic plan, basically, we're looking at multiple things. One, technology, which is the ambient, smart rooms, redesigning systems. But we're also looking at the exiting of seasoned nurses out of the organization, right? We've already identified, we know how many, where. So we're looking at, primary care nursing has been in place since 1980. I don't know if anybody, maybe some of us remember 1980. That's when primary nursing came about. So one of the things we looked at is we are doing a whole strategic planning this year, actually, on a team approach to nursing care. That's not what people want to default to think about the RN LPN model. That's kind of one piece. But we're looking at what other teams or caregivers or stakeholders and patients to assume things get done well. What do they need to help the nurses work at the top of their license. So we're going to actually, we did a vascular access team, but we're expanding it to actually manage all accesses, all lines, all dressings in the organization. We're going to do a dressing and wound care team, not just to look at potential hospital-acquired injuries, but also, doing the dressing changes, doing all the wound care, using our walk nurses to the top of their ability. We have engaged our rehab team for mobility teams. We used a lot of that during COVID, but, mobility is the best way to help a patient not become, not to have a fall, not to have a pressure injury, not to have an event, right? To get them up and moving, especially if you look at the elderly population, the longer they stay in bed, you decrease their mobility exponentially. So one of the things we've identified is the potential of how many patients can we reduce going to who was at home before and then end up going to rehab afterwards. Is it because we left them in bed for 3 to 4 days and now we contributed to their decline? So we're looking at different programs and different teams that have different skill sets that actually impact patients. And it doesn't have to be a nurse-driven process. So that's kind of where we're going now.
So your focus is really having your nurse practice to the top of their license by supporting them in a different way. I love it. So I think there were questions in the Q&A. I'm going to open that up to Lydia to give us some information on that.
Yes, as a reminder, if you have any questions, please put them in the Q&A and we can answer them here. If you don't feel comfortable doing that now, you can always email them to Patti or Deb. I do have one though right now. Is there something that's like the most important item that contributed to your success with this? Like if there was only one thing that you would put an emphasis on, what would that be?
If it's the newer nurses coming out, it's your transition to practice and it's your nurse mentors. They have, besides the unit leaders, transition to practice as a team. Someone is reaching out to these nurses on a weekly basis and a monthly basis, different approaches to ensure they're getting what they need. They have a voice. They have concerns that can be addressed right away. And we have found that has been from their own voice to us, that they just having the ability to reach out to someone or someone reaching out to them has made a big difference.
Can I just ask a clarifying question on that one too? When you say somebody's working with them weekly and monthly, that's not including the manager. The manager, in addition, is meeting with them, or the educator, whoever is working and helping develop them as well, correct?
Correct, because this became how we redid our whole nursing residency program. We upended it. And when you look at why nurses leave, that first year they struggle. So how do we make sure they don't have those struggles, or how do we meet the needs of where they are struggling right at the time that's occurring, not waiting until their 90 days are done or their orientation's done. We're trying to make sure we are meeting them at their needed level right at that point in time.
Yeah, and I've heard through multiple different conversations and different organizations that I've worked with that they're saying now that most nurses in that Gen Z population are saying about 60% of them are saying they've made up their mind whether or not they feel supported in the first couple of weeks. So making sure that they know whether or not they want to stay there is early on, and hitting them early is really important. It's really critical. What other questions do you have in there for us?
Yeah. You mentioned mentors. How do you choose the mentors?
So the mentors are part of our preceptor program. So if you're not even, we have preceptors that aren't just on the floors precepting new hires. We have what we call like super preceptors. So these preceptors are just available to go around. It's like phone a friend, right? So I can phone a friend. I can call this preceptor and they will come directly to you. It's like, I've never done this by myself, this procedure maybe. Then it's like, well, I'm here. I'm going to help you. So let's walk through it together. So we have that availability and that flexibility. It's just giving them what they need at the time so they become comfortable in their skill sets. And I think you got to have them to be able to know right away. They don't have to struggle or find a charge nurse who's very busy. They have someone that they can just reach out to who's going to come to and help them.
Your mentorship is so critical, especially early on, where they feel comfortable. They have a relationship built that they feel comfortable that they can ask these kind of questions and not feel like it's a stupid question, right? Or that they feel like they have that resource that's a safe space. Any other questions? I think we have time for maybe one.
Yeah, I have one more here. This one's a little longer. Have you considered offering virtual options to sell your new CST or OR tech roles to other organizations for remote classes if they had appropriate clinical instructors in their facility?
So we do have an OR tech program. We grew our own program. We train our own, and that's part of our career ladder for like our sterilization techs usually, and our PCAs or CNAs want to become OR techs. So we have our own program that follows the ARN and actually ends up them becoming certified. We work with right now we've not offered that because some of it's so much hands-on if you're looking at an OR tech program. But we have sim training here for them, but we actually take them into the OR and just kind of hire them. And we've hired mostly internal, but we've had some external ones as well come. We've had a school. We work with a school that brings students in as well and their programs, but we have no schools close. Again, grow our own, build our own. So if we don't have it, we will develop our own programs. And they end up becoming certified, just as if they went. And the college actually helps us through the ORN program to supplement what the education has to be.
So it sounds like you're starting in the schools, right? Pretty early in engaging them in the schools.
We engage in the schools, but some of them, so like our own staff, growing our own is one of the big things for us. And OR techs was a hard position to fill here. So we put a program together. Actually, my surgical director put a program together to train, and with surgeons willing to help, we're going to train our own OR techs. So we're in year 4 of OR tech training. We have trained 10, and all have stayed in our surgery. And of those 10, I think 5 have already passed their certifications. So again, it's just they feel, to me, it's like you feel important, and then that word of mouth goes out to schools. That word of mouth goes out to family. That willingness that this organization is willing to help you and help you get new skills that you never thought you could have before.
And that's so important. We hear a lot from rural areas that it's very difficult to recruit. And you have that same kind of challenge, right? So it is really making sure that you're treating the team that you have in front of you well and building your own community. Did we get to all of the questions?
We just had 2 more come through. So one is, how did you address externs that are having difficulty passing their licensure exam?
Okay, so because we get the nurse extern ones when they're in the second semester, a lot of education has a really close connection with them. They work 1 or 2 shifts. They work 1 shift. I mean, we pay for them. They work 1 shift, but they're connected to clinical education, who's also connected with the schools to understand where struggles they might be so that we can provide additional training here or additional time, or if they're struggling with a process and don't understanding it, putting them in a unit where that process is really highly used, right? So they can see, sometimes you can read it, can't understand it, but if you can see it and touch it and feel it, it makes a difference because depending on how you learn. So we have worked with the schools a lot to ensure that we go down this path together, not just to teach to the NCLEX, but let's teach to a value of what a nurse needs to know, including critical thinking skills. And we spend a lot of time with our nurse externs, which I think is a reason why we end up hiring all of our nurse extern 2s, all pretty much get hired. We're like at 99% get hired right away.
Love it. What other question? One last question.
Yeah, just one more. What is your nurse to patient ratio in order to have a super nurse to be available?
So the current nurse to patient ratios, we try to do acuity based. We're getting ready to go to intensity based versus acuity based. But Like on a med-surg unit, it's no more, max is 1 to 5. But if the acuity requires, we will accommodate a 1 to 4, depending on patient needs. Our progressive care unit is 1 to 4. These extra nurse preceptors, though, have no patient assignment. That is not their role. These super preceptors or whatever, I'm sure there's a better name we can come up with. But I think the whole point is that's the whole appropriateness about it, is they're not assigned to someone. They're not assigned to a team. They have the flexibility to go to the nurse to where they're at. So we don't, and we have, it's 2 per shift, getting ready to expand to put one for specialty areas so they can go to the ICU or the ED as well.
So they're not unit based. That's just from a clarity perspective. They can go anywhere in the organization at any point in time. So they're experts in their practice.
Yes.
Awesome. Well, Deb, I truly appreciate you helping us solve so many of the different problems that all of us are really struggling with to really figure out how do we engage our year 1 nurse and make them feel nurtured, cared for, and a part of a team that makes them want to stay with your organization for a very long time. So truly appreciate your time and appreciate all of you for tuning in. Thank you.
Thank you.